The thought of experiencing a heart attack while alone is deeply unnerving, yet it's a scenario that occurs far more often than most people realize. Many assume they'll have ample time to react, that the symptoms will be unmistakable, or that someone will be nearby to provide immediate assistance. The reality, however, is far more sobering. The first few minutes of a heart attack are critical, and your immediate actions, or lack thereof, can determine whether you survive. The good news is that even if you're alone, you can significantly increase your chances of survival by acting swiftly and following a clear, deliberate plan. In this detailed guide, we'll walk you through 7 essential life-saving steps to take if you suspect a heart attack while alone. These steps are simple, require no medical training or specialized equipment, and are designed to help you stay calm, act decisively, and maximize your odds of survival. We'll explore how to identify subtle early warning signs, what to do immediately, how to minimize strain on your heart, and small but critical actions that can buy you precious time until professional help arrives. Stay with us until the end, as the final steps are often overlooked but could be pivotal in saving your life. Let's dive into this comprehensive roadmap to empower you to take control in a crisis. Step 1. Recognizing the subtle early warning signs of a heart attack. The first and most vital step in surviving a heart attack alone is recognizing its symptoms as early as possible. Many people imagine a heart attack as a sudden dramatic event, with intense crushing chest pain, like the scenes depicted in movies or TV shows. In reality, heart attacks often begin with subtle, easily dismissed symptoms that can escalate rapidly if ignored. Acting on these early warning signs is your best defense against severe heart damage, cardiac arrest, or even death. A heart attack typically presents as a deep, uncomfortable pressure or squeezing sensation in the center or left side of your chest. This may feel like a heavy weight pressing down a tight band, constricting your chest, or a persistent ache that doesn't quite register as sharp pain. The discomfort may come in waves, subsiding briefly before returning, which can lead you to think it's not serious. However, if the sensation persists for more than a few minutes or recurs intermittently, it's a major red flag. Beyond chest discomfort, you might experience shortness of breath, even without physical exertion. You may feel like you can't get enough air, even while sitting still or lying down. Pain or discomfort can radiate to other areas, such as your arms, often the left, but sometimes both shoulders, neck, jaw, upper back, or even your stomach, where it might mimic indigestion or heartburn. Additional symptoms include sudden lightheadedness, cold sweats, nausea, particularly common in women, dizziness, or an overwhelming sense of fatigue that feels disproportionate to your activity level. For some individuals, especially women, older adults, or those with atypical presentations, symptoms may be even subtler, such as mild upper back pressure, vague stomach discomfort, or a general sense of unease without clear chest pain. Consider the case of Margaret, a 70-year-old retiree who was reading quietly in her living room when she noticed a persistent ache under her collarbone, accompanied by clammy hands, slight nausea, and difficulty taking a full breath. Initially, she thought it might be stress fatigue or indigestion from her lunch earlier that day. However, she recalled a conversation with her doctor about how heart attack symptoms can be subtle, especially in women and older adults. By trusting her instincts and acting promptly, she avoided a potentially fatal delay. Similarly, James, a 65-year-old man, felt an unusual tightness in his chest while working at his desk. He initially attributed it to poor posture, but noticed it was accompanied by a cold sweat and mild jaw discomfort. Recalling a health seminar, he recognized these as potential heart attack signs and acted immediately, a decision that likely saved his life. Your body often provides subtle clues before a heart attack escalates, and these early warnings are your critical window to act before the situation becomes life-threatening. Waiting for dramatic, unmistakable symptoms, such as collapsing in agony, could mean waiting too long. To prepare, familiarize yourself with these symptoms and take them seriously, even if they seem mild or vague. Risk factors like high blood pressure, high cholesterol, diabetes, smoking, obesity, a sedentary lifestyle, or a family history of heart disease increase your likelihood of a heart attack. So be extra vigilant if these apply to you. If you experience a combination of chest pressure, shortness of breath, radiating discomfort, or unusual fatigue, stop whatever you're doing immediately. Don't dismiss it as indigestion, stress, or a minor issue, and avoid the temptation to tough it out or wait for symptoms to worsen. Recognizing these signs as potential heart attack symptoms is your first and most critical line of defense. Trust your gut. Your life may depend on it. To enhance your preparedness, consider discussing your risk factors with your doctor during routine checkups. Ask about your personal heart attack risk and whether you have any unique symptoms to watch for, especially if you have a history of heart disease or related conditions. Keep a mental checklist of symptoms and practice listening to your body. For example, if you've ever experienced indigestion or muscle strain, note how those sensations differ from the persistent heavy pressure of a potential heart attack. By staying proactive and informed, you can act swiftly and confidently if symptoms arise. Step 2. Calling 911 immediately to get life-saving help. Once you suspect a heart attack, the next critical step is to call 911 without hesitation. Do not wait to see if the symptoms improve. Attempt to drive yourself to the hospital or worry about seeming overly cautious or embarrassed. Calling emergency services is the fastest and most effective way to access life-saving care, and every second counts during a heart attack. Delaying help increases the risk of permanent heart damage, cardiac arrest, or death as the heart muscle begins to die without adequate blood flow. When you call 911, trained dispatchers begin coordinating a response immediately, dispatching paramedics equipped with specialized tools such as portable defibrillators, oxygen, and medications like nitroglycerin or anti-clotting drugs to stabilize you. Paramedics can also monitor your vital signs en route to the hospital, which is critical if your condition worsens, such as progressing to a dangerous heart rhythm. Driving yourself is one of the most dangerous choices you can make during a heart attack. You could lose consciousness, cause a car accident that endangers yourself and others, or delay access to critical interventions that only paramedics can provide. By calling 911, you ensure that professional help comes to you as quickly as possible, equipped to handle a life-threatening emergency. Take the example of Thomas, a 75-year-old widower who was gardening alone in his backyard when he felt an unusual ache in his jaw and chest, followed by a wave of nausea and lightheadedness. Initially, he considered calling a neighbor or his daughter to drive him to the hospital, but he remembered advice from a community health seminar. If you think it's a heart attack, call 911 first, then contact family. He dialed 911 immediately, and paramedics arrived just as his symptoms intensified into severe chest pain and shortness of breath. Their rapid intervention, including administering oxygen and medications, stabilized him and saved his life. Similarly, Linda, a 78-year-old woman, felt a strange ache in her left shoulder and nausea while alone at home. She hesitated, worried about bothering emergency services, but recalled a nurse's advice. Better to call 911 and be wrong than wait and be too late. Her call ensured paramedics reached her in time to prevent a fatal outcome. You don't need to be absolutely certain you're having a heart attack to call 911. Emergency dispatchers are trained to handle uncertainty and would rather respond to a false alarm than miss a chance to save a life. If you live alone, keep your phone easily accessible at all times on your personal bedside table or kitchen counter. Many smartphones have an emergency call feature that works even when the phone is locked. Learn how to use it in advance by checking your phone's settings. For example, on iPhones, you can activate the Emergency SOS feature by pressing the side button multiple times, while Android devices often have a similar function accessible from the lock screen. If speaking is difficult due to shortness of breath or pain, stay calm and use this feature to connect with help. In some regions, texting 911 is an option. If you can't speak, check with your local emergency services to confirm availability and save the number in your phone. To prepare, practice accessing your phone's emergency features and keep it charged, especially at night or when you're alone. If you live in a rural area with potentially slower response times, consider informing a neighbor or family member after calling 911 so they can assist if needed. The sooner you call, the sooner help arrives, giving you the best chance of survival. Acting without delay is one of the most powerful steps you can take to protect your life. Step 3. Chewing an aspirin to prevent blood clot growth. After calling 911, the next vital action is to chew a standard 325 milligram aspirin, provided you're not allergic to aspirin and don't take blood thinners such as warfarin, apixaban, or rivaroxaban that contraindicate its use. If you're unsure about whether aspirin is safe for you, consult your doctor ahead of time to clarify. especially if you have a history of bleeding disorders, stomach ulcers, or other medical conditions. Chewing rather than swallowing allows the aspirin to enter your bloodstream more quickly, which can significantly improve your survival odds. Aspirin works by inhibiting platelet activity, helping to slow or prevent the growth of a blood clot that may be blocking a coronary artery, the primary cause of most heart attacks. Research, including studies from the American Heart Association and the American College of Cardiology, shows that chewing aspirin during a heart attack can restore some blood flow to the heart muscle, buying you critical time until paramedics arrive. For the fastest effect, use an uncoated standard 325 milligram aspirin, as coated or enteric coated versions take longer to absorb due to their protective coating. If you only have low-dose 81 milligrams aspirin, often called baby aspirin, it can still help, though it's less effective than a full dose. Avoid taking aspirin on an empty stomach if possible to minimize the risk of stomach irritation, but in a heart attack, the risk of clotting far outweighs this concern. Consider the case of John, a 68-year-old man who felt a heavy squeezing sensation in his chest one evening while watching TV alone. He recalled reading about aspirin's benefits in a health magazine, found a bottle in his bathroom cabinet, and chewed a 325 milligram tablet while sitting calmly and waiting for paramedics. His cardiologist later confirmed that this action likely reduced the extent of heart muscle damage, aiding his recovery. Similarly, Sarah, a 72-year-old woman, kept aspirin in her kitchen drawer after learning about its role in heart attack survival. When she felt chest pressure and nausea, she chewed a tablet immediately after calling 911, a decision that her doctor credited with minimizing her heart damage. If you live alone, store aspirin in multiple accessible locations, such as your nightstand, kitchen counter, bathroom cabinet, or even a small container in your purse, wallet, or car. Check regularly to ensure the aspirin hasn't expired, as expired medication may be less effective. Inform family members, close friends, or neighbors where you keep your aspirin in case they need to assist you in an emergency. If you have a history of stomach ulcers, gastrointestinal bleeding, or aspirin allergies, consult your doctor in advance to determine whether aspirin is safe for you and whether you should keep an alternative medication, such as nitroglycerin, if prescribed, on hand. Some people carry a small emergency kit with aspirin and a note listing their medications and allergies, which can be a lifesaver in a crisis. To prepare, make it a habit to check your aspirin supply every few months, especially if you're at higher risk for heart disease due to factors like age, high blood pressure, high cholesterol, diabetes, or a family history. Consider setting a reminder on your phone or calendar to replace expired aspirin. If you're traveling or away from home, carry a few tablets in a labeled container for quick access. This simple science-backed step is a cornerstone of emergency heart attack care and can mean the difference between a full recovery and irreversible heart damage or worse. Step 4. Resting to minimize strain on your heart. Once you've called 911 and taken aspirin, your next priority is to minimize stress on your heart by stopping all physical activity immediately. Sit or lie down in a safe, comfortable position and avoid any unnecessary movement. Pacing, gathering belongings, tidying up, or trying to push through the discomfort increases your heart's oxygen demand, which is already compromised during a heart attack. Your heart is struggling to pump blood effectively, and any additional strain could worsen the damage, trigger a dangerous arrhythmia, or lead to cardiac arrest. The ideal position is sitting upright with your back-supported feet flat on the ground and arms resting loosely at your sides. This posture reduces your heart's workload while keeping you stable and comfortable, allowing you to breathe more easily. If you feel dizzy, lightheaded, or faint, lie down on your side with your head slightly elevated, using a pillow cushion or rolled up clothing to avoid choking or discomfort if nausea worsens. Resist the urge to keep moving, even if you feel restless, anxious, or embarrassed about doing nothing after calling for help. In this moment, staying still is one of the most important actions you can take. It conserves your heart's energy and oxygen supply, potentially preventing further damage or a life-threatening complication. Take the example of Evelyn, an 80-year-old woman who felt chest tightness and shortness of breath while preparing dinner in her kitchen. Her instinct was to finish cooking and clean up, as she didn't want to leave a mess or seem overly dramatic. However, she recalled her cardiologist's advice: if you think it's your heart, stop everything and rest. Everything else can wait. She sat in her recliner propped up with cushions and stayed still, which likely prevented her symptoms from escalating into a full-blown cardiac arrest. Similarly, David, a 71-year-old man, felt chest pressure while walking his dog. He sat on a nearby bench, leashed his dog to a post, and rested, resisting the urge to walk home. This decision kept his heart stable until paramedics arrived. If you're in a chair without armrest or back support, avoid slumping. Keep your spine straight to maintain open breathing and reduce physical strain. If you're outdoors, find a safe spot to sit, such as a bench step or low wall, and avoid standing or walking unnecessarily. If you're in a car when symptoms start, pull over. Safely turn on your hazard lights and rest while waiting for help. To prepare, identify comfortable, accessible spots in your home where you can rest quickly in an emergency, such as a sturdy chair, sofa, or bed. If you have mobility issues, keep a walker cane or other assistive device nearby to help you settle safely. Practicing this step mentally, visualizing where you'll rest and how you'll stay calm, can make it easier to act decisively in a crisis. Additionally, consider your surroundings. If you live in a multi-story home, try to stay on the ground floor during a potential heart attack to make it easier for paramedics to reach you. If you're in a public place such as a park or store, calmly alert someone nearby if possible that you've called 911 and need to rest so they can guide responders to you. By resting and breathing slowly, you give your heart the best chance to stabilize until professional help arrives. Step 5. Unlocking your door to ensure quick access for paramedics. If you have the strength after calling 911 and settling into a resting position, unlock your front door to allow paramedics immediate access. This small but critical action can save precious seconds, as a locked door may force responders to break in, delaying treatment. In a heart attack, every second counts. Faster access to care can mean the difference between recovery and severe complications, such as permanent heart damage, cardiac arrest, or death. If you live in an apartment, condo, or gated community, consider additional logistics in advance. Is your address clearly visible from the street or building entrance? Do you have a spare key stored with a trusted neighbor, building manager, or in a secure medical lockbox? A smart lock with a code can also simplify access for responders. Share the code with 911 dispatchers if possible. For example, Michael, a 73-year-old man living alone in a condo, felt heart attack symptoms one morning. After calling 911 and chewing an aspirin, he managed to unlock his front door while staying seated near the entryway. Paramedics later told him that this saved them nearly a minute of entry time, which was critical as his condition deteriorated rapidly into ventricular fibrillation. Their quick access allowed them to use a defibrillator in time to save his life. If walking to the door feels risky or causes increased pain, dizziness, or shortness of breath, prioritize staying still and breathing calmly. Your safety comes first. However, if you're stable and near the door unlocking, it can significantly speed up the response. To prepare, consider keeping a spare key in a secure but accessible location, such as a lockbox with a code, and inform 911 dispatchers of its location if needed. If you live in a multi-story home, try to position yourself on the ground floor near the main entrance to make it easier for paramedics to reach you. If you have a smart doorbell or security camera, you can use it to communicate with responders or confirm your location. For those in rural areas with potentially slower response times, consider additional steps such as leaving a porch light on or placing a reflective marker at your driveway to help paramedics find your home quickly, especially at night. If you live in a gated community, inform the gate attendant or security team when you call 911 so they can direct responders to your location. These small preparations can make a significant difference in how quickly help reaches you. Step 6. Leveraging your phone's emergency features effectively. Your smartphone is a powerful lifeline during a heart attack, and using its features wisely can enhance your chances of survival. When speaking with 911, switch to speakerphone mode to keep your hands free and reduce physical strain. This allows you to focus on breathing slowly and staying calm while ensuring the dispatcher can hear you clearly, even if your condition worsens. Dispatchers are trained to pick up on subtle cues such as changes in your breathing voice or background noises, which can help them assess your situation and relay critical information to paramedics. Additionally, set up your phone's emergency medical ID feature, available on both iPhones and Android devices. This feature allows you to store vital information, such as your age, blood type, medical conditions, e.g., diabetes, hypertension, or heart disease allergies, e.g., to aspirin, penicillin, or other medications, current medications, and emergency contact numbers. This data is accessible from your phone's lock screen, meaning paramedics can access it even if you're unconscious or unable to communicate. For example, Clara, a 77-year-old woman, felt chest pain and dizziness while alone at home. She called 911 but fainted before paramedics arrived. Fortunately, her medical ID alerted responders to her diabetes and penicillin allergy, preventing potentially harmful treatments and guiding their care. Setting up your medical ID takes just a few minutes. Do it now by navigating to the health or emergency settings on your phone, e.g., the Health app on iPhone or the Personal Safety app on Android. Some smartphones also allow you to share your location with 911 dispatchers, automatically ensuring help finds you quickly, even if you can't provide your address or become disoriented. If you're in an area with text to 911 capabilities, you can send a message if speaking is too difficult. Check with your local emergency services to confirm availability and save the number in your phone. For example, in some U.S. counties, texting 911 is an option for those who can't speak due to shortness of breath or other symptoms. To prepare, practice accessing your phone's emergency features, such as the SOS button or medical ID, so you can use them instinctively in a crisis. Keep your phone charged and within reach at all times, especially at night or when you're alone. If you use a smartwatch or fitness tracker, consider enabling its emergency features such as fall detection or heart rate alerts, which can automatically notify emergency services if you collapse or your heart rate becomes irregular. For example, some Apple Watches can detect atrial fibrillation or sudden drops in heart rate and prompt you to call 911. These tools can be especially valuable if you live alone or have a history of heart issues. By leveraging your phone and other devices effectively, you ensure that critical information and communication channels are available when you need them most. Step 7. Controlling your breathing to stay calm and stable. Panic is a natural response during a heart attack, but it can worsen your condition by increasing your heart rate and oxygen demand, potentially triggering dangerous arrhythmias or exacerbating heart damage. Controlled breathing can help calm your nervous system, lower your heart rate, and reduce strain on your heart. One effective technique is to inhale slowly through your nose for 4 seconds, hold your breath for a brief moment, about 2 seconds, and exhale gently through your mouth for 6 seconds. Repeat this cycle, focusing on the rhythm to anchor your body and mind. This won't reverse the heart attack, but it can help stabilize your heart rhythm, maintain oxygen flow, and prevent stress-induced complications, buying you critical time until help arrives. Consider the story of Robert, an 82-year-old man who felt intense chest pain and overwhelming fear one night while alone at home. He remembered a breathing exercise he'd learned during physical therapy for a previous heart condition. By focusing on slow, steady breaths, inhaling for 4, holding briefly, and exhaling for 6, he kept his heart rate from spiking dangerously until paramedics arrived. His calm response likely prevented his symptoms from escalating into cardiac arrest. Similarly, Anna, a 69-year-old woman, used a similar technique she'd practiced during yoga classes. When she felt chest pressure and shortness of breath, she focused on her breathing to stay calm, which helped her remain conscious until help arrived. You can practice this technique during calm moments, such as while relaxing, meditating, or watching TV, so it becomes second nature. Other calming strategies like visualizing a peaceful scene, e.g., a quiet beach or forest, counting slowly, or repeating a calming phrase, e.g., I am safe, help is coming, can also help manage panic. If you have a smartwatch or fitness tracker with a heart rate monitor, use it to monitor your pulse during practice sessions to ensure you're staying calm and to track how your body responds to stress. For example, some devices provide guided breathing exercises that can be useful in a crisis. To prepare, practice controlled breathing regularly, especially if you're at higher risk for heart issues due to factors like age, high blood pressure, high cholesterol, diabetes, or a family history of heart disease. If you have a history of anxiety or panic attacks, work with a healthcare provider or therapist to develop additional coping strategies such as mindfulness or progressive muscle relaxation that can complement controlled breathing. In a crisis, this small act of control can make a significant difference in keeping your heart stable until professional help arrives. Final thoughts: preparation and action are your greatest allies. Surviving a heart attack alone isn't just about luck. It's about preparation, awareness, and decisive action. These 7 steps, recognizing symptoms, early calling 911, immediately chewing an aspirin, resting to reduce heart strain, unlocking your door using your phone's emergency features, and controlling your breathing form a powerful evidence-based strategy to maximize your survival odds. Each step is designed to buy you time, minimize damage to your heart, and empower you to take control even when you're alone. Reflect on these steps and take proactive measures now to prepare for a potential emergency. Do you have aspirin stored in accessible locations such as your nightstand kitchen or purse? Is your phone's medical ID set up with your medical details, allergies, and emergency contacts? Is your front door easy for paramedics to access with a spare key or lockbox available if needed? Have you practiced controlled breathing to stay calm under pressure? These preparations take minimal effort, but can make a life or death difference. Share this knowledge with loved ones, especially those who live alone or have risk factors for heart disease such as high blood pressure, high cholesterol, diabetes, smoking, or a family history. Discussing these steps with family or friends can also ensure they know how to assist you in an emergency. For example, tell them where you keep your aspirin, how to access your home, or how to use your phone's medical ID if you're unable to communicate. Consider enrolling in a basic first aid or CPR course to deepen your understanding of emergency response and encourage others to do the same. These courses, often offered by organizations like the American Red Cross or local hospitals, can teach you how to recognize heart attack symptoms and respond effectively even in non-emergency situations. If you have a history of heart issues or risk factors, talk to your doctor about creating a personalized emergency plan. Ask whether aspirin is safe for you, what specific symptoms to watch for, and whether you should keep other medications such as nitroglycerin on hand if prescribed. Keep a list of your medications, allergies, and medical conditions in a visible location such as on your fridge or in your wallet to assist paramedics if you can't communicate. If you live in a rural area or a place with longer emergency response times, consider additional preparations such as installing a medical alert system or sharing your location with a trusted neighbor or family member. Ultimately, surviving a heart attack alone comes down to acting fast and staying steady. By preparing in advance and following these 7 steps, you give yourself the best possible chance to survive a heart attack and recover fully. Don't wait for a crisis to take action. Start today by reviewing your risk factors, setting up your emergency tools, and practicing these steps. Stay vigilant, stay prepared, and empower yourself to face this potential emergency with confidence, clarity, and calm. Your life is worth it.